The Beck Anxiety Inventory, created by Dr. Aaron T. Beck and other colleagues, is a 21-question multiple-choice self-report inventory that is used for measuring the severity of anxiety in children and adults. The questions used in this measure ask about common symptoms of anxiety that the subject has had during the past week. It is designed for individuals who are of 7 years of age or older and takes 5 to 10 minutes to complete. Several studies have found the Beck Anxiety Inventory to be an accurate measure of anxiety symptoms in children and adults. Question breakdown, scoring and interpretation. Each question inquires about how bothersome a symptom of anxiety has been for the subject over the past month. Scoring. The BAI is based on a 0 to 3-point scale, with each question being scored as follows based on participant response: 0 points, not 81 Albanian lek point, mildly it did not bother me much. 2 points, moderately it wasn't pleasant at times. 3 points, severely it bothered me a lot. The point values of the chosen answer choices are then summed to produce a total measure score. The BAI has a maximum score of 63. Interpretation of scores. The following criteria indicates the severity of anxiety based on the total score: 0 to 21, low anxiety. This score suggests a healthy level of anxiety, but could also result from the ability of the subject to mask their anxious symptoms or if the subject is in denial of such symptoms. 22 to 35, moderate anxiety. This score suggests that the individual should work to identify triggers of anxiety symptoms and try to manage anxiety through stress reduction techniques. 36 to 63, severe anxiety. This score suggests that anxiety symptoms could be potentially harmful to the physical and/or mental well-being of the individual. Consulting with a professional may be beneficial if severe anxiety continues. Note: women with anxiety disorders tend to score 4 points higher than men with anxiety disorders. Two-factor approach to anxiety. Though anxiety can be thought of as having several components, including cognitive, somatic, affective, and behavioral components, Beck al. included only 2 components in the BAI's original proposal: cognitive and somatic. The cognitive subscale provides a measure of fearful thoughts and impaired cognitive functioning, and the somatic subscale measures the symptoms of physiological arousal. Since the introduction of the BAI, other factor structures have been implemented, including a 4-factor structure used by Beck and Steer with anxious outpatients that included neurophysiological, autonomic symptoms, subjective, and panic components of anxiety. In 1993, Beck, Steer, and Beck used a 3-factor structure including subjective, somatic, and panic subscale scores to differentiate among a sample of clinically anxious outpatients, because the somatic subscale is emphasized on the BAI, with 15 out of 21 items measuring physiological symptoms. Perhaps the cognitive, affective, and behavioral components of anxiety are being de-emphasized. Therefore, the BAI functions more adequately in anxiety disorders with a high somatic component, such as panic disorder. On the other hand, the BAI won't function as adequately for disorders such as social phobia or obsessive-compulsive disorder, which have a stronger cognitive or behavioral component. Clinical use. The BAI was specifically designed as an inventory for measuring clinical anxiety that minimizes the overlap between depression and anxiety scales. While several studies have shown that anxiety measures, including the State Trait Anxiety Inventory, are either highly correlated or indistinguishable from depression, the BAI is shown to be less contaminated by depressive content. Since the BAI does only questions symptoms occurring over the last week, it is not a measure of trait anxiety or state anxiety. The BAI can be described as a measure of prolonged state anxiety, which, in a clinical setting, is an important assessment. A version of the BAI, the Beck Anxiety Inventory Trait, was developed in 2008 to assess trait anxiety rather than immediate or prolonged state anxiety, much like the STAI. However, unlike the STAI, the BAIT was developed to minimize the overlap between anxiety and depression. A 1999 review found that the BAI was the third most used research measure of anxiety, behind the STAI and the Fear Survey Schedule, which provides quantitative information about how clients react to possible sources of maladaptive emotional reactions. The BAI has been used in a variety of different patient groups, including adolescents. Though support exists for using the BAI with high school students and psychiatric inpatient samples of ages 14 to 18 years, the recently developed diagnostic tool, Beck Youth Inventories, 2nd edition, contains an anxiety inventory of 20 questions specifically designed for children and adolescents ages 7 to 18 years old. Limitations: though the BAI was developed to minimize its overlap with the depression scale as measured by the Beck Depression Inventory, a correlation of or equals 0.66, p 3.0 co. 2s. Steer R.A., Kumar G., Rainier E.W.F. Use of the Beck Anxiety Inventory with adolescent psychiatric outpatients. Psychological Report 76, 459 a €465 doi, 10.2466/PR 0.1995.76.2.459. Steer R.A., Rainier E.W.F., Beck A.T., Clark Dar. Further evidence for the validity of the Beck Anxiety Inventory with psychiatric outpatients. Journal of Anxiety Disorders 7, 195 a €205 doi, 10.1016/0887-6185, 93, 90002-3. Ethereal J.L., Arian P.A. Psychometric Evaluation of the Beck Anxiety Inventory with older medical patients. Psychological Assessment 9, 136 a €144 doi, 10.1037/1040-3590.9.2.136. Cohn P.M., Cantor L., to Psycho T.L., Beck A.T. The Beck Anxiety Inventory Trait, a measure of dispositional anxiety not contaminated by dispositional depression. Journal of Personality Assessment 90, 499 a €506 doi, 10.1080/002238908022488844. Piotrowski C. The Status of the Beck Anxiety Inventory in Contemporary Research. Psychol Rep 85, 261 a €2 doi, 10.2466/PR 0.85.5.261-262. PMID 10,575,991. Asmanor, Hoffman J., Barrios FX, Copper BA, Breitenstein JL, Hahn SK. Factor structure, reliability, and validity of the Beck Anxiety Inventory in adolescent psychiatric inpatients. J. Klin Psychol 58, 443 a €56 doi, 10.1002/JCLP 1154. PMID 11,920,696. Beck J.S., Beck A.T., Jolly J.B., Steer R.A. Beck Youth Inventories 2nd edition for Children and Adolescents Manual. San Antonio, Psych Corp. Beck A.T., Steer R.A., Ball R., Rainier E.W.F. Comparison of Beck Depression Inventories IAM2 in Psychiatric Outpatients. Journal of Personality Assessment 67, 588 a €597 doi, 10.1207 per second 15327752 JPA 670313. PMID 8,991,972. Stultz N., Kritz Christoph P. Distinguishing Anxiety and Depression in Self-Report, Purification of the Beck Anxiety Inventory and Beck Depression Inventory II. Journal of Clinical Psychology 66, 927 a €940 doi, 10.1002/JCLP 20701. Munting ADT, Van der Veltz Cornelis CM, Van Marwij HWJ, Spinhoven P., Penninks BWJH, Van Bolcom AJLM. Is the Beck Anxiety Inventory a good tool to assess the severity of anxiety? A primary care study in the Netherlands study of depression and anxiety. BMC Family Practice 12. Krasaki C., Howard R., Mann A. The Relationship Between Anxiety Disorders and Age. International Journal of Geriatric Psychiatry 13, 79 €99 doi, 10.1002/, Sakai, 1099-1166, 199802, 13, 23.0 co. 2G. De Ayala J., Vanderhaar Carlson D.J., Kim D. Assessing the Reliability of the Beck Anxiety Inventory Scores. Educational and Psychological Measurement 65, 742 €756 doi, 10.1177/0013164405278557. Ethereal J. L., Gause M. The Beck Anxiety Inventory in Older Adults with Generalized Anxiety Disorder. Journal of Psychopathology and Behavioral Assessment 27, 17 €24 doi, 10.1007 per second 10862-005-3261-3.